Have you ever had a random thought that scared you or confused you?
Yes, I have. Yes.
Have you ever had a thought that just wouldn't go away?
Yes, I have.
Yes.
Do you have any rituals that you just have to do or you get anxiety?
No.
Yes. Yes. Yeah. Yes.
Maybe, a few.
Do you or anyone you know have OCD?
Yes.
Yeah.
Well, he kind of refuses to believe anything's wrong with him, but I'm fairly certain he has OCD.
A woman from the 1800s known as Mademoiselle F was terrified that she would accidentally steal something. She had never stolen anything in her life accidentally or on purpose. She never even had the urge to steal, but one random day she had a thought. What if I accidentally smuggled something in my apron? She stopped wearing loose clothing in case of something of value getting caught in the folds. She wore shoes several sizes too small, severely damaging her feet because she was afraid that she would accidentally smuggle other people's property in her shoes. She would fear that by simply touching something, she could lower its value. She had to comb her hair hundreds of times each night, not for vanity's sake, but to make sure that she didn't have anything in her hair. Her friends would tell her that if she took something, she would know it, and that she isn't a thief. Unfortunately, those reassurances didn't do anything for her because she already knew all that. She wasn't crazy. In fact, she led a completely normal life outside of her fear. She knew that the touch of her fingers couldn't alter the value of money. She knew that it was a 1 in a million chance that anything could be hidden in her shoes without her knowledge, but she still couldn't shake the feeling that it could happen. Mademoiselle F was one of the first ever recorded cases of OCD. What is OCD?
It's a disorder where the person is characterized by an inability to let go of a task, and they lead it to perfection, as in the obsessive compulsive disorder, where they are forced to psychologically complete something.
Obsessive compulsive disorder. So I think you start becoming really obsessed with keeping things in line, in order, like neat, clean, and exactly how you want it, and in exactly one way. Otherwise, it like completely messes up your brain.
A condition, a physical condition.
I think it stands for obsessive compulsive disorder, and I know like it's a common misconception that OCD is just cleaning your room a lot. Like, no, that's not it. I know it's like more serious than that.
OCD, obsessive-compulsive disorder, is a clinical condition in which someone's obsessions keep him or her from enjoying life. It's not just about wanting to keep things orderly or clean or perfect all the time. Like Mademoiselle F, people who have OCD can have any random obsession that keeps them occupied. OCD is when your obsessions crowd out your mind and you do things to keep them away. If your obsession is the idea that you may get HIV, you'll spend lots of time watching out for sharp things that may puncture your skin and give you HIV. If you scrape your knee, you're worried and stressed that the surface you cut yourself on had blood on it. You'll find ways to be tested, but the reassurance that you aren't infected won't help much. If you're a checker, you'll spend too much time a day making sure that all the doors are locked and light switches are off and irons are unplugged. Like Mademoiselle F, most OCD patients understand that leaving the lights on, even after you checked it, or catching HIV from the ground is unlikely, maybe even 1 in a million. But while that might reassure most people, it scares people with OCD. To them, 1 in a million means that there's a chance. That's typical obsessions and compulsions OCD, but there are many types. The just not right experience OCD is a type of OCD in which if you don't do something you usually do, like turn up your TV volume to 33, you not only get uneasy, but get scary thoughts that something bad may happen if you don't fix the volume immediately. There is also a type of OCD called just O OCD. With just O, the symptoms are less visible to the outside. They have scary and unsettling obsessions like regular OCD, but instead of trying to fix the problem or prevent it from happening, they try to stifle the thoughts, which makes things worse. The thoughts build up like a dam. Many avoid things that can trigger the thoughts, which is counteracted because when they avoid the thoughts, they're thinking about them. Some have calming or distracting techniques. Like playing a musical instrument or repeating mantras to themselves in their head. Others turn to self-harm because to them, physical pain is no match for the pain of having scary recurring thoughts. What causes OCD?
I don't know.
I think it's maybe like can you be born with? I think you can be like born with like kind of like not symptoms, but like the mindset, same as like your parents or your family, and it may be like how you grow up can like influence you having OCD, and it might be like if your parents are like a certain way, and then it might trigger other things in your brain to start.
I don't know.
A number of things can contribute to OCD. A person has a thought that may be average, like they may not have left the door locked, or unusual or intrusive, like everyone they love, dead or alive, will be tortured with rats. It may sound strange, but this is an actual example. Anyway, as you saw in the first part, almost everyone gets weird thoughts like that, and having them doesn't mean you have OCD. Most people who have thoughts like that brush them off like they're no big deal, but sometimes the thoughts don't go away and they become obsessions. Again, as you saw in the beginning, most people have suffered from obsessions at some point in their lives, and although they may be distressing, they are normal and might not allude to other problems. Only when those thoughts turn into obsessions and they hurt the quality of your life does that mean that you could have OCD. A lot of people have certain things that they have to do, and not doing them gives them anxiety. However, that is also normal. If you have to listen to music when you wake up, and you feel strange when you get up without it, that doesn't mean that you have OCD. If not listening to music brings about thoughts that make you unhappy, then that might allude to an underlying problem. Like Megan said, your environment is a common cause of OCD. The way you're raised and what influences you have matter. Also, traumatic experiences can bring about OCD, similar to PTSD. Sometimes, normal things can trigger OCD, like an average and necessary warning to wear a condom, causing a person to obsess that they catch HIV. Responsibility can cause OCD. An Israeli war officer developed OCD because she was told daily to make sure that war secrets weren't lost. She developed obsessive thoughts about losing them, and the consequences that would follow. A certain infection in children can bring about OCD almost overnight. But for every person who knows what causes their OCD, there's another person who has no idea what made them that way.
How many people do you think have OCD?
Less than 1% of the population. Not very many.
Maybe like 1 in like 10 people.
I'd say like 1/3 of America.
70% of people in the US.
People can develop OCD at any time in their lives. It can last for years or for a short period. So OCD is more common than you think. According to BeyondOCD.org, 2.3% of adults have reported having been diagnosed with OCD in their lives, and 1 in every 100 kids. However, greater than 1 in every 4 adults have reported OCD-like symptoms without formal diagnosis. A lot of people have OCD, but many of them have such minor OCD that it doesn't need treatment. A popular misconception is that you either do or don't have OCD, but it is better on a dimensional scale. For example, we all have blood pressure, but we all don't have hypertension. If someone takes a test for OCD, for example a Yale Brown test, and scores an 8, it technically means that they could have OCD, but their OCD would be so minor that it doesn't mean much. They don't need treatment. On the Yale Brown test, they accept a scale for OCD. Simply saying that you have random obsessive thoughts that sometimes trouble you gives you a 3 on the Yale Brown scale, which means you have little or no symptoms of OCD. But as the beginning showed, most people have similar feelings. But they are still on the scale, so saying someone does or does not have OCD is insufficient. Simply having OCD can mean that you need your doors to be closed or you think something bad may happen, or that you're so obsessed with feeling the shape of your eyes that you'll eventually poke them out by touching them too much. A much better way of saying someone has OCD is saying that they have a 20 Yale Brown score, like they do with IQs. You can say someone's a genius, but the next question is going to be his or her IQ. When someone says they have OCD, to really know what that means, you have to tell them their Yale Brown score.
How do they treat OCD?
I don't know.
I think my mom is a therapist, so I think she told me that there's like some medicine to help and like counseling as well to help like kind of like sort out the problems for OCD.
By certain practices, I don't know, maybe going to a prior vet. I don't even know how to say it. But yeah, I don't know.
People go to psychiatrists. Yeah, medications for it maybe.
It is important that people understand OCD because there actually is OCD discrimination. Since certain medications only work on some OCD patients, pharmaceutical companies can't make a wonder drug that every OCD patient can use, and they cannot make as much money off of OCD medication. A lot of people report having OCD-like thoughts are punished. An elementary school teacher once mentioned that she was afraid to drive because she had graphic and scary thoughts that she would get into catastrophic accidents. She had just OCD and she needed help, but when the school board found out, they suspended her from her job because they thought she was too dangerous to be around children. She eventually got her job back, but because the school board didn't understand OCD and know that the scary thoughts that come with it didn't mean anything about what a person wants to do or will do in the future, she almost lost her job. Mothers have been separated from their children because authorities mistook intrusive thoughts that they might hurt them for a desire to hurt their children. If people understood what OCD was, cases of OCD discrimination wouldn't happen, and people would feel more comfortable talking about their mental struggles. If people feel more comfortable talking about it, more people can get the help they need to get better. The second reason OCD awareness is important is because a lot of people think that OCD is obsessive orderliness and cleaning, and that's not accurate. That's only a type of OCD. A person who's just a checker, or even the just not right experience OCD, might not even realize they might have OCD and need treatment. They may not know there is treatment for what they have. There are many different types of therapy and medications for people with OCD. With the right treatment, most people with OCD can go into remission and live an almost normal life.